What's up, guys? How's it going? K More with More Muscle. Today we'll be talking about infectious gastroenteritis. So, guys, this is kind of like stomach flu. If you eat something bad or if you eat some bad chemicals, this is basically, the medical term is infectious gastroenteritis. Rotavirus is an enzyme, or E. coli, Salmonella, C. diff, C. botulinum, Staphylococcus, G. lamblia, Shigellosis, calcivirus, and Yersinia enterocolitis. So, guys, these are all infectious gastroenteritis. Now, let's talk about this, guys. A big thing is, so you're going to be having, fluid coming from both ends. Be vomiting and, having diarrhea. Guys, this is a major risk for, the biggest thing is dehydration. So when you're, losing so much fluid, you got to be monitoring your dehydration. Some good things that you can do is eat things like rice, bananas, things that are easy digestible, like crackers, because they're very easily digestible, and they're going to slow. They don't, like, for example, crackers, they don't have a ton of fiber in them, especially like the saltine crackers. They don't have a lot of fiber, so it kind of slows down that diarrhea. Um, Anyways, guys, let's talk about this. So when you're dealing with someone with gastroenteritis, you want to get their height, weight. You want to sample their urine, their temperature, and you want to avoid antibiotics if it's Salmonella or E. coli. And basically, you want to the most important thing is the oral oral replacement solution, like what's it called? Like basically like electrolyte drinks. You want to get that. Make sure their sodium levels are between 135 and 150. Potassium levels, you want 3.5 to 5. And that's going to help. You want to avoid other, things that will cause like not as much fluid intake. Like, for example, fruit juices and stuff like that with a lot of added sugar, because a lot of those calories are going to be coming from added sugar. And you want to be, basically eating healthy stuff. But yeah, so avoid fruit juices, carbonated sodas, gelatin, because they all have a high carbohydrate content and a low electrolyte content. You want to avoid caffeine because it's a mild diuretic. That means it makes you urinate. And chicken or beef broth has too much sodium and not enough carbohydrates. So you want to have something that has sufficient carbohydrates and sufficient electrolytes. That's going to help you the most. Anyways, guys, let's get back to it. There's dehydration. There's isotonic. That's like 0.9 saline. When they give you an IV, that's isotonic. Basically, it means it's like the same osmolality as your blood. Hypotonic is actually lower. So, for example, if you've ingested too much sodium, they'll give you a hypotonic solution, because that's going to get rid of that sodium, right? Because it's lower osmolality, and it's going to your body's going to be able to excrete that sodium. And then hypertonic is the opposite, right? So you're going to have a ton of sodium, and this is for people that are extremely dehydrated. They don't have enough sodium in their blood. If their sodium levels lower than 135, this is going to be very beneficial for them. So it's hypertonic fluid, right? And now we're going to talk about dehydration. So mild is 3 to 5% of your weight loss for infants, and 3 to 4% in children. So if you have that type of weight loss, that's very dangerous. And matter of fact, in other countries that are poor, obviously the number one killer in the United States is heart disease here, but in other countries it's actually diarrhea, and a big part of that is because of the excessive fluid loss. So it's important to get those electrolytes in. It's very, we see a lot of people that come to the ER because of electrolyte loss, or just dehydration, and they get those IV electrolytes in, and they just feel like a completely different person. Dehydration is a big thing. You want to eat foods that have lots of electrolytes, fruits, vegetables. Sodium, obviously, you want to eat that, kind of sparingly, because basically all the foods that are packaged and canned in the United States, they have sodium in it already. So it's really hard to be deficient in sodium here, but it's definitely possible if you eat really clean. You do want to definitely get a little bit of sodium or a little bit of salt, a little small sprinkle on your food if you eat really clean. But anyways, guys, moderate weight loss is 6 to 9% in infants, 6 to 8% in children, and you're gonna see, capillary refill between 2 to 4 seconds. So, guys, capillary refill is when you basically touch the nail and you see how fast the water comes back. I mean, the color comes back in your finger. If it takes a long time, that indicates that you could be, severely dehydrated. And if it's after 3 seconds, that's a serious sign, and that's something that needs to be noted. And then severe weight loss is greater than 10% in infants and 10% in children. So guys, this is capillary refill greater than 4 seconds. So that's really, you want to monitor that, and that's extreme dehydration that can lead to shock and orthostatic hypotension, guys. Orthostatic blood pressure hypotension, that's basically like when you stand up, you sit to stand, your blood pressure is going to drop like crazy, and you're going to feel dizzy. You might, you're a fall risk because you're going to have, you might fall, and you're going to see very extremely dry mucous membranes, dry skin, and sunken eyeballs, guys. The eyeballs going to be sunken in, and you're going to see oliguria or anuria. So urea means urination, and A means none. So no urine, and oliguria is like a small amount of urine. So yeah, you want to make sure they can get rehydration, and you want to give them about, if it's mild, you want to give them about 50 milliliters per kilogram every 4 hours. Moderate, you want to do 100 milligrams per kilogram, and basically you want to stop their diarrhea. So have them, stop what they're eating. And so, yeah, guys, this is really important to stay hydrated, especially if you're, doing extreme heat. And guys, remember, gastroenteritis, the stomach flu, can lead to dehydration. So you got to monitor that. And guys, this is basically what we've been learning in school. And the other thing is, when you give an IV fluid, you got to also monitor that you don't give them too much, because some of that fluid can get, into the lungs if there's too much, if it's overflow, and that can cause someone to, have respiratory issues, which can cause basically, heart failure, or they can't breathe or whatnot. So you got to monitor, make sure they're getting the right amount of fluids. What I like, it's really actually hard to stay perfectly hydrated all the time. It's, it's a struggle, but what you can do, something I do personally, I don't know if this will work for everyone, but every 3 hours, drink a cup of water, eat a fruit or vegetable, like every 3 hours. And when you don't overeat, you're not going to have to, you're less likely to have diarrhea. If you eat small amounts of food, you're going to have, if you eat large amounts of food, you're going to have diarrhea, which can be harmful, But if you eat small amounts of food, you drink a cup of water every 3 hours or whatever, and you maybe sprinkle your, some salt on some healthy food every other meal, you'll be okay. You'll be, hydrated. And if you play, sports, if you, do excessive running or anything like that, just making sure you're getting that sodium in, because that's the easiest electrolyte that can go, up and down. Potassium is hard because almost every fruit and vegetable has potassium in it. So it's kind of harder unless you're doing like a crazy fast or something. That'd be normal. But anyways, guys, gastroenteritis, stomach flu, what you should do as a nurse. Thanks.